Welcome back. It is exactly 8:37 a.m. and we're now going to be talking with founder and general secretary of HAITU, which actually is the Health and Allied Workers Indaba Trade Union. That, of course, is you, Lerato Mthunzi. A very good morning to you. Welcome.
Thank you so much, Julie.
Okay, so tell us, when did you decide that you needed a trade union to represent nurses and other allied healthcare professionals? When did this all come into being?
In 2015, I think when I rejoined public sector from private sector, the great need of the working force to be well represented by a union that is independent, non-aligned, apolitical, that would really just champion the voice of the very marginalized healthcare workers. That's where this came to being when we knocked at every door of all the existing trade unions, and we didn't find a suitable home that was ready to be really the voice and really the heartbeat of the healthcare workers.
What's the situation like now for nurses? Look, undoubtedly, they well taken care of in the private sector, but in the public sector, what is their situation in terms of working conditions, pay, etc.? Uh, also, and added to that, let me also add that very especially in the public sector, nurses have a very, very bad a very bad reputation. They seen and are spoken about as being non-caring, couldn't be bothered, supplying a very, very careless care towards their patients. They're very impatient with the patients and so forth. How do you respond to that? I must, I hasten to add that in the private sector, it's totally different. Every time I've been in hospital or been in a situation where I needed nursing care, they've been exemplary in the service they provide. But obviously the public sector is totally different, and they do service the bulk of the population in South Africa.
I think you spot on, Julie, by saying the nurses in the public sector are servicing the majority of South Africa. And majority of those South Africans are the ones that really do not have. And unfortunately, the ratios, the number of healthcare workers, the need, the increased disease profile, as well as the numbers that they're just servicing, it's really outstrips the demand. We find our nurses literally not coping. Totally burned out, totally not in a right state of mind, as you would imagine. I mean, I can paint you a picture of a general ward where you're looking after 60 patients and it's just the two of you, where you
Oh.
are a midwife. Instead of helping that one woman to bed down, you're actually helping 5 to 7 women at every given chance. So there are chances of being exposed to malpractice, or I mean, the next patient expects you to be smiling, but smiling from what? That you just not were not able to assist the next patient that could be saved, and that patient is dead. There is nothing that puts a smile on the nurse at this present moment. And you're right. It almost seems like they are offering a carefree or careless health, but that's not the reality. The reality is that they are overly burdened, and they are offering just quantity, not so much of a quality healthcare. And that's exactly where HAITU comes in, when we're saying, wait, someone has got to care for the carer, someone has got to be the voice for these nurses, because this that we're expecting them to do, it's absolutely not practical. It's absolutely not just inhumane to the patients, but also to the carers themselves. And you are painting a good picture about private sector, and I beg to differ, because 90% of the time where you go to our private healthcare center in the country, you're actually thinking that you're being nursed by a nurse, a qualified nurse registered with the South African Nursing Council, and that's not a case. You just, your the acumen and the experience, as well as the training of those posing as nurses, and 90% not even registered nurses. They're actually carers that private sector has taken cheap labor, and some of them not even South Africans. So it's something that we, because we are looking at the frills, we are looking at the clean sheets and the food. We are not literally looking at the clinical aspect of it. That's where we'll find ourselves placed in private sector, but they also have got their own Achilles heels. Public
Okay.
sector.
Lerato, you're making a very damning statement there regarding nurses in the private sector. Can we park that for another discussion, because I think it is a discussion that needs to be had. And I do want you to then supply evidence when we talk about that issue. It's going to be very lengthy, obviously. Let's get back to the issue of nurses in general. You are saying bottom line is that they're overworked and underpaid. Where do you come in? How do you try and through the through the union that you're representing, how do you how do you fight their case? Question number one. Question number two, are we taking in enough young people into nursing colleges and training them? Because on the one hand, we have huge unemployment, young people crying that they can't find jobs. Shouldn't government be opening up nursing services, training up these young people and giving them meaningful employ?
Where health and allied workers in Indaba Trade Union come in is where we are advocating for uh, obviously training of more healthcare workers. Our government has been exceptionally negligent when it comes to increasing the number of nurses that are trained. A lot of colleges have been closed in the public sector. We are training less and less numbers. In 2000 and in the 2000 up to 2020, when we were training close to about 1,000 at a given time in one province, currently we are seeing us training less than 100 a year,
Sure.
and the output after 3 years, we are looking at maybe having about 38 nurses who would qualify for a big province like Gauteng. So our government is really not serious, is not taking healthcare and also nursing training seriously. As we speak now, today there is a meeting for the new cohort of those who have studied under Regulation 1 R171. This is the 3-year course. That is a new course, and the Gauteng government is telling us that we can't even employ them. We don't need them. I mean, for us, that is absurd. We saw the MEC even saying there is no shortage, being a denialist of shortage of nursing. So government in that front has totally failed the people of South Africa. They've failed healthcare, and I don't think there's any way that they can actually redeem themselves when it comes to that. They've also the South African Nursing Council, they've not been greatly helpful, because they've closed down a lot of private nursing colleges for regulatory reasons, and we do understand, because we're not saying nursing colleges should not comply, but we're saying there should be an easy, no red tape type of setup where private nursing colleges are also find a space, because definitely government is not doing a stellar work. But we also want definitely quality nursing care, institutions of higher learning such as universities to be allowed to train nurses, because the country does need nurses both in private and in public sector. And when I say private, I'm also including NGOs that are in dire need of qualified nursing personnel.
So, what is HAITU, U.S. Secretary and founder and General Secretary of HAITU? What are you doing to address the problem? You are a
Look,
union. You need to represent your members fairly by taking this very pertinent and serious issue to government. What are you guys doing?
Look, I think we are taking the bull by the horns. Just last week there was a nursing Indaba that was hosted by the South African Nursing Council, where the department is also involved. We are holding all the regulatory bodies, including the CHE, accountable. The governments in different spheres, in different provinces, from national and up to the lower echelons, they know if there is an issue about nursing training or nursing practice, we will not mince our words when it comes to that. We have taken a bold stand to say we are not going to show any favor, no mercy. If people are going to really compromise on both nursing training and both and nursing practice, we are not going to allow them to get scot-free. We are also have, called out the nursing council, because as a regulatory body, they also play a role of a public protector or the patient's protector, but they've not been proactive in doing that, in ensuring that our facilities are audited accordingly, and they are practicing or nurses are practicing in a safe environment. But they are quick to punitively and punish nurses, strike them off the roll for conditions that are quite extremely bad. For there's no other way of putting it. But the employer, like we said, we are not friends of the employer. The employer must just do right by nurses, so that ultimately the nurses are able to give quality healthcare to the patients, the people of South Africa.
Is that the reason why we have such a mass exodus of nurses out of the country for more lucrative opportunities elsewhere globally?
Absolutely. And you must understand, the more we've got this brain drain of nurses going outside the country, those who remain in our wards at the shop floor are getting the brunt. They're actually getting the most raw deal. Like I said earlier on, you find that when your colleagues are leaving for what they call greener pastures, those who stand by, who want to be patriotic, are the ones we are going to call rude, are the ones we're going to call impatient, because they are the ones that are actually, taking this thing head on by themselves, with no help from the employer, with no help from the regulatory body. And when they go one step that we don't approve, we are going to punish them. We are going to speak bad about them on media. It's just a catch-22 situation for the nurse in South Africa today.
Lerato Mthunzi, founder and obviously founder and general secretary at Health and Allied Workers a Trade Union. HAITU, thank you indeed for your thoughts on the show this morning. We are going to take you up in a future program to discuss the issue around so-called nurses in the private sector. Thank you indeed. Go well. God bless.
Thank you. God bless.
8:49 News and Views on Salam Media. Standing by to talk to us is Rihanna Musaji, the Barefoot Facilitator, to talk to us about Urban 99.